Hi, I'm Tom Flass. I'm a pediatric gastroenterologist with Kalispell Regional Healthcare in Kalispell, Montana, and we're going to be talking a little bit today about celiac disease and gluten sensitivity. How are they similar? How are they different? Who has them? What are the symptoms? To kind of dispel some of the myths that are floating around out there.
So today we're going to review celiac and gluten sensitivity. What are some of the similarities and differences? Who could have it? And how to get tested. So first off, what is gluten? So gluten refers to a group of special proteins found in wheat, barley, and rye. Namely, the two specific proteins are glutenin and gliadin. And these proteins are somewhat unique in that they're very difficult to digest, but they also give the springiness and elasticity to baked goods and breads. So a common question we get asked is how could such a common food be making me sick? First off, because of the unique properties of these proteins, they resist digestion in the gut, which can make them more allergenic. But also research is showing that these proteins may be causing direct damage to the intestine and in some cases causing leaky gut, which is a process by which the intestine is letting through things into the bloodstream that it normally would not, potentially causing autoimmune disease and inflammation. In addition, different compounds in these grains may be recognized by the immune system as a foreign invader, much as it would view a bacteria or a virus. So there's three distinct categories of gluten-related disorders. So the first of which being autoimmune, which refers to specifically celiac disease, but also two other conditions, one called gluten ataxia, which is a neurological condition that is gluten responsive, and then a rash that's very closely related to celiac called dermatitis herpetiformis. There are the classic allergic responses to wheat and some of the other related grains that will cause things like rashes, respiratory allergies, anaphylactic shock. And then there's a third category, which is where gluten sensitivity falls, which is not autoimmune and not allergic, but it's some other type of immune response. So first, we will review celiac. So who has celiac? So the current estimates are that it's 1 in 80 to 1 in 100 people in the U.S. That means it's a lot more common than people think, and up to 3 million people in the U.S. may currently have celiac disease, but 80 to 90% of these are undiagnosed because they haven't presented in the so-called classical fashion. There is a female predominance, and it's not just Caucasians. There's also a high incidence in people of Middle Eastern and Northern African descent. There are certain other at-risk groups for celiac that are much more likely to have or to get the disease. Type 1 diabetics are 10 to 15 times more likely to get celiac than the general population. Patients with Down syndrome are also significantly more likely to get celiac, as well as with Turner or Williams syndrome. People with other autoimmune diseases, especially autoimmune thyroid disease, are more likely to have or to get celiac, 2 to 8 times more likely. And if you have a first-degree relative with celiac, meaning a brother, sister, or parent, then you're 5 to 10 times more likely to get celiac than someone in the general population, and probably should be screened. Even second-degree relatives, so cousins, there's a twofold risk of celiac disease. Celiac has been known as the great imitator because it can present in a variety of fashions with a variety of complaints. So the classic celiac symptoms are, in a child, poor weight gain, recurrent diarrhea, abdominal distension, muscle wasting or skinny arms and big belly, anorexia, nausea and vomiting. But sometimes just recurrent abdominal pain or significant constipation can be complaints. But there are many non-GI symptoms of celiac. One, dermatitis herpetiformis, is that rash that we discussed, and that usually hits older patients, adults mostly. Patients with unexplained dental enamel defects, unexplained anemia, unexplained elevation of liver enzyme, all can be related back to celiac, and certainly in a child who's not growing, they need to be ruled out for celiac disease. There are also a host of potential associations with neuropsychiatric symptoms such as migraines, chronic fatigue, anxiety, but these associations are less strong. So how is celiac diagnosed? So the official celiac criteria are as follows. You need to have a positive blood test, so usually a tissue transglutaminase or TTG, but sometimes an anti-endomysial antibody, which is an older test but still a fairly valid test, and a newer test called deamidated gliadin peptide, or DGP. These are the only 3 legitimate blood tests for celiac disease. To confirm the diagnosis, we often need to do an upper endoscopy where a tube is passed down the throat into the small bowel while the patient is asleep, and a small sample of that tissue taken and looked at under the microscope. And there's a very classic finding with celiac disease where there's damage to the lining of the small bowel that's visible under the microscope. And if genetics are sent, there's only 2 genes that allow for celiac disease, one called DQ2 and the other one called DQ8. And if neither of these 2 genes are present, it's almost impossible to get celiac. The other defining criteria is that symptoms must resolve on a gluten-free diet. So let's compare and contrast that to non-celiac gluten sensitivity. So what is non-celiac gluten sensitivity? Well, it's in some ways similar response as celiac, so it can be a gastrointestinal or a non-intestinal reaction to gluten-containing foods. So the symptoms may completely mimic celiac disease and resolve on a gluten-free diet. So diarrhea, urgency, bloating, constipation, abdominal pain, a lot of irritable bowel syndrome type complaints are very common with non-celiac gluten sensitivity, but also some non-GI complaints such as brain fog, headache, joint pains, fatigue. We don't currently know how many people may have gluten sensitivity, but some pretty good research coming out of the Center for Celiac Research estimated about 6% of a population of about 6,000 adults who were screened. And the patients who had irritable bowel syndrome type symptoms are very overrepresented in people with gluten sensitivity. So that means 10 to 20 million Americans may have gluten sensitivity. Again, most of these probably don't even realize it. So 5 to 7 times more common than celiac disease, but again, the numbers are currently unclear. So how is it different than celiac? Well, it's not mediated by either the allergic part of your immune system or something called T-cell mediated, which is what celiac disease is. So it's a completely different response by the body. It's thought to be what's called an innate immune reaction. So there's something that responds in the body negatively to gluten, but it's not those other 2 reactions. It does not cause intestinal damage, which is definitely very different than celiac. And people with gluten sensitivity usually do not have to be as strict on their gluten avoidance as somebody with celiac, who has to be 100% avoidant. So it may not even be gluten. There may be other compounds in the wheat that are causing the reaction, but there's really no standardized test for gluten sensitivity, so it makes getting accurate numbers and sometimes a diagnosis a little bit difficult. So what are the proposed criteria for diagnosing gluten sensitivity? So irritable bowel syndrome-like symptoms, a negative celiac test, potentially negative biopsies if an endoscopy is performed, negative wheat allergy testing, and the symptoms resolve on a gluten-free diet and return when gluten is reintroduced. But again, there can be a lot of non-intestinal symptoms with gluten sensitivity, including a rash, headache, fatigue, brain fog, depression, numbness and tingling in the fingers, and the symptoms may overlap and be very similar with chronic fatigue syndrome and fibromyalgia. So we'll kind of review some take-home points. So celiac, 1% of the population, and the numbers are increasing. Up to 90% of the current celiacs are undiagnosed. So essentially anyone with unexplained chronic GI symptoms or irritable bowel syndrome should be screened for celiac disease, as well as patients in those high-risk groups that we talked about earlier, and people with unexplained anemia or unexplained elevations of their liver tests. And the initial screening is a TTG-IgA along with a total IgA. And any screening positive patients should be referred to either pediatric or adult GI. Non-celiac gluten sensitivity is increasingly becoming recognized as a separate entity, but there's no valid screening lab for this group. So after celiac is ruled out, you may still want to consider trying a gluten-free diet for 1 to 2 months with a gluten challenge and see if symptoms return. And if you respond, then implement a long-term gluten-free diet. And don't let anyone tell you whether or not you feel better on a gluten-free diet. Really, only you can tell. So for more information, contact us at Kalispell Gastro at 406-752-7441, or you can look us up on the web at the URLs listed below. And we are currently providing outreach to the following areas in Missoula, Great Falls, Helena, Anaconda, Polson, and Bozeman. Thank you for listening.